What are the symptoms of PTSD? Symptoms of post-traumatic stress disorder can be divided into four categories: intrusive memories, changes in the physical and emotional reactions, avoidance, and unfavorable changes in thinking and attitude. Symptoms of PTSD usually begin within 3 months of the traumatic incident, but they sometimes emerge later. To meet the criteria for PTSD, symptoms must last longer than 1 month, and they must be severe enough to interfere with aspects of daily life such as relationships or work. The symptoms also must be unrelated to medication, substance use, or other illness. The course of the illness varies. Although some people recover within 6 months, others have symptoms that last for a year or longer. People with PTSD often have co-occurring conditions such as depression, substance use, or one or more anxiety disorders. After a dangerous event, it is natural to have some symptoms or even to feel detached from the experience, as though you are observing things rather than experiencing them. A healthcare provider, such as a psychiatrist, psychologist, or clinical social worker who has experience helping people with mental illness, can determine whether symptoms meet the criteria for PTSD. To be diagnosed with PTSD, an adult must have all of the following for at least 1 month: at least one re-experiencing symptom, at least one avoidance symptom, at least 2 arousal and reactivity symptoms, at least 2 cognition and mood symptoms.
Hello, Melissa. I'm Sheeta. I'm going to be your nurse today. How are you doing?
Good, how are you?
I'm doing pretty well. Is everything okay?
What do you mean?
Well, what brings you in today?
Well, I feel not at ease. I don't feel my normal self. I kind of am dreading for the day to come on, and every time I think about like going to work or having to interact with my coworkers or just seeing new people, I just get this wave of anxiety, and I don't know, I guess that's not my normal self, so I feel a little off.
What about your new job makes you uncomfortable?
I don't know, I think it might be like just seeing people or having to interact with others.
Okay. Do you have a good support group at home?
Um,
Someone you can talk to about this or
I
anything?
mean, I do, but I don't really talk to them.
Okay. So what happens when you do go to work?
Most of the times I'm trying to find reasons to leave, or I go as late as possible. I kind of disappear at all moments that I can possibly, like, try to just hide, basically.
So you just want to get away from everybody and just not socialize, or
Yeah, I kind of want to be to myself.
is there any issues at work that you're having?
Not really, just, I don't know. I guess me being late and things of that nature
Okay.
could be an issue.
Would you like for me to recommend you to one of the community groups? Would you think you could talk to someone there more than you could a family or friend member?
I guess I can try.
Okay, well I can give you a brochure for that.
Okay.
Okay.
Who develops PTSD? Anyone can develop PTSD at any age. This includes combat veterans as well as people who have experienced or witnessed a physical or sexual assault, abuse, an accident, a disaster, or terror attack, or other serious events. People who have PTSD may feel stressed or frightened, even when they are no longer in danger. Not everyone with PTSD has been through a dangerous event. In some cases, learning that a relative or close friend experienced trauma can cause PTSD. According to the National Center for PTSD, a program of the U.S. Department of Veterans Affairs, about 7 or 8 of every 100 people will experience PTSD in their lifetime. Women are more likely than men to develop PTSD. Certain aspects of the traumatic event and some biological factors, such as genes, may make some people more likely to develop PTSD. In the upcoming scenarios, each patient has already been diagnosed by a mental health professional.
Hello, Diana. I'm Emily. I'm going to be your nurse today. I'm just here to do a quick assessment on you. Hang on. Let me just get my hand sanitizer. Okay. Alright. So, what are we here for today?
So within the last few weeks, I have been having trouble sleeping. It seems like I am not getting a full night's rest. My sleep is broken.
Okay.
Sometimes I'm up for days at a time.
Okay, how long has this been going on?
I'd say about like 3 to 4 weeks maybe.
Okay. So do you just have trouble falling asleep? Once you're asleep, can you stay asleep, or is it just like interrupted sleep patterns?
It's both. Sometimes I wake up frequently. I'm a very light sleeper, so like anything really wakes me up. And then sometimes I'll literally lay in bed and I'll start thinking about where I put my social security card, or if I fed the cat, or like just a bunch of random things that I don't need to be thinking of.
Yeah. Do you try like earplugs or anything to cancel out any noise, like if you have a noisy environment?
I've tried like pink noise and brown noise, like a sound machine. Sometimes that helps, but sometimes it's just as loud as the thoughts. And
yeah. What about, do you drink any caffeine before bed or alcohol that could interrupt that? Have you tried avoiding caffeine hours before bed?
I don't drink any alcohol, and I do not typically drink caffeine.
All right. And what about medications? Are you on any medications?
I'm on hydroxine. It's 25 milligrams for insomnia.
Okay, and how long have you been on that?
About 2 months.
Okay. All right. So I'm gonna give you some suggestions and tips to help you sleep better at night. So when you wake up and you feel restless and stuff, I just want you to get up, walk to the kitchen, grab some water, come sit down, just try to like deep breathe, and then also before bed, make sure you're not drinking any alcohol. Do you have to get up and use the bathroom at night?
Not really.
Okay, I was gonna say try not to drink too much fluids right before you go to bed so you can get a better night's sleep. Also, you can take a nice warm shower before bed. That kind of like eases you and just kind of settles everything down. Also, make sure you're not having like any bright lights. Close the curtains. You can have like a little dim light if you need to, but just try that. And if you have any other problems or trouble sleeping, just come back in and check, and we could put you on maybe a different medication. But yeah, just keep me updated, and maybe keep like a sleeping journal, like a log, and like when you wake up and stuff, so you can kind of look back and trace it.
Okay, those are some really great trips that I look forward to trying. Thank you.
You're welcome.
Psychotherapy, sometimes called talk therapy, includes a variety of treatment techniques that mental health professionals use to help people identify and change troubling emotions, thoughts, and behaviors. Psychotherapy can provide support, education, and guidance to people with PTSD and their families. This type of treatment can occur one-on-one or in a group setting and usually lasts anywhere from 6 to 12 weeks, but can last longer depending on the needs of the individual. One common type of psychotherapy, called cognitive behavioral therapy, can include exposure therapy and/or cognitive restructuring. Exposure therapy helps people learn to manage their fear by gradually exposing them in a safe way to the trauma that they experienced. As part of exposure therapy, people may think or write about the traumatic event, or revisit the place where it happened. This therapy can help people with PTSD reduce their symptoms that cause them distress. Cognitive restructuring helps people make sense of the traumatic event. Sometimes people remember the event differently than how it really happened, or they may feel guilty or have shame about something that is not their fault. Cognitive restructuring can help people with PTSD think about what happened in a different or realistic way. You can learn more about different types of psychotherapy on the NIMH website, www.nimh.nih.gov/health/publications/post-traumatic-stress.
Hello, my name is Emma and I'll be your nurse for today.
Hello, Miss Emma. How are you?
I'm good, thank you. How are you?
I'm doing pretty well.
What brought you in today?
Well, I've just been having a lot of trouble lately, especially since it's summertime and everything. And my kids, they like to go swimming. They learn how to swim from their dad. They're like little fish, but you know, I had a bad experience when I was little, and I'm not really good at swimming, so I don't want to take them because what if they drowned, or what if I drown?
Can you tell me more about your experience? How did that happen?
When I was real little, my sister and I were playing by the pool, and she pushed me in, and I was under the water for a really long time.
How old were you?
I was 7.
And how about your sister? How old was she then?
She was 10.
Did you go to the hospital?
No, I was okay.
Did you get any help?
No, we just, my parents came out and helped me out of the pool, and we never really talked about it again.
How old are your kids?
My daughter, she's 15, and my son's 13.
Do you feel like they're affected by your fear too? Do you think they have the same fear?
Yeah, they're kind of upset with me right now because they can't go to the pool, the beach, or anything, so.
Do you think that fear affects your kids too? Like, how do you talk to your kids? Are they?
Yeah, if I could, overcome this, then maybe we could all go and enjoy the water. And, I mean, it's really hot. We're in Florida, so.
Do you take any medications for?
Not yet. When I went to the doctor, they just kind of wanted me to wait and kind of see, like, talk to people first and see, but I can't find any places to go to.
Do you have any sleeping problems?
Sometimes, like, I have a lot of bad dreams about it, so, yeah, so, or not all the time, but sometimes, like, it comes back and the whole
You have
thing.
never seek for the help for that?
Not until here recently. Not until it started really affecting my kids.
But you don't, like, when you go to the beach, what do you experience? What kind of feelings do you get?
I just want to grab them up and just run, get away from it, not be next to the water.
Okay.
Do we have anything around here that I could go where I could talk to people or anything?
Yeah, we can, I'm gonna go ahead and refer you to, doctor where you can get help.
Okay, that sounds good. I think that'll help out a lot.
Okay, was it more than 2?
Mental health hotline. How is PTSD treated? It is important for anyone with PTSD symptoms to work with a mental health professional who has experienced treating PTSD. The main treatments are psychotherapy, medications, or both. An experienced mental health professional can help people find a treatment plan that meets their symptoms and needs. Some types of psychotherapy target PTSD symptoms, and others focus on social, family, or job-related problems. Effective psychotherapists tend to emphasize a few key components, including learning skills to help identify triggers and manage symptoms. Some people with PTSD may be living through an ongoing trauma, such as being in an abusive relationship. In these cases, treatment is usually most effective when it addresses both the traumatic situation and the symptoms. People who have PTSD or who are exposed to trauma also may experience panic disorder, depression, substance abuse, or suicidal thoughts. Treatment for this condition can help with recovery after trauma. Research shows that support from family and friends also can be an important part of recovery. If you or anyone you know suffers from PTSD, please call 866-903-3787.
Action.
Hi.
Hi.
How are you doing today?
I'm doing okay. How are you?
I'm good, thank you. My name is Melissa. I'll be your nurse for today. What's your name?
I'm Emily.
Okay. And when were you born? Your date of birth?
July 27th, 1999.
All right. Cool. So, what brings you in today?
Well, I just moved to a new town, and I'm starting at a new school. And my whole life I've done cheerleading, and I love it. But I just tried out for this new cheer team, and I'm kind of struggling with myself, and I just don't feel like I'm good enough, and I'm comparing myself to the other teammates.
Can you tell me more about that? Why do you feel like you're not good enough?
Well, about 4 years ago, I had a really bad accident from cheerleading. I was in the air and I fell. I didn't get caught, and I broke my arm.
Okay.
Yeah, so it was really hard, and so now I just feel like I'm too scared to try new things, and I see the other girls doing it, and I just compare myself to them, and I feel like I'm just not good enough. I'm struggling with that because I feel like I can do better, but I'm just scared.
Okay. All right. So, seeing that you are on the cheer team, I do want to ask questions about your physiological well-being, right? So, how's your dieting going?
Well, to be on the cheer team, you have to have I try not to eat a lot, just because I kind of restrict my eating.
Sorry.
It's okay. I restrict my eating just a little bit, so I kind of stay small, so I can be a flyer, like the one that goes up in the air. So I eat, but I don't think I'm eating as much as I should be.
So would you say you're following a specific diet? Are you getting enough
No, I
calcium,
just eat
proteins?
barely one meal a day.
Oh, okay.
Yeah, if that, just kind of a snack here and there.
All right. Well, that's something that we can talk about later. So can you tell me any physical or emotional changes that you're experiencing?
Yeah, when I'm feeling down, I just have these unwanted thoughts, and I just feel like I feel hopeless. I don't have any nothing going for me, nothing good in my life.
Okay, gotcha. Are you suicidal?
I've thought about it, but I don't have any plans on doing anything. But when I'm feeling down, sometimes I just think, oh, maybe I should just not be here.
Okay, we can bring that up to your doctor. And then as far as things that we can do for you, we could definitely get you someone that you can talk to, maybe consult with a dietitian to help you understand more about your dieting. And just some group therapy as well. That way you can communicate and cope with other people.
Yeah, I think once I start becoming friends with the other girls on the team, I think they could be become some of my support group. But right now it's just hard because I don't really know them.
Okay. Well, do you have any other questions or concerns?
I don't think so. I think over some therapy and time, it'll all get better.
Very cool. Well, thank you for coming in today.
Thank you.
You're welcome.
The most studied type of medication for treating PTSD is a type of antidepressant medication called selective serotonin reuptake inhibitors, SSRIs. These might help control PTS symptoms such as sadness, worry, anger, and feeling emotionally numb. SSRIs and other medications may be prescribed along with psychotherapy. Other medications may help address specific PTSD symptoms such as sleep problems and nightmares. Healthcare providers and patients can work together to find the best medication or combination of meds as well as the right dose. Check the U.S. Food and Drug Administration website for the latest information on patient medication guides, warnings, or newly approved medications.